be talking about the bones of the skull and such, because as you know, as I told you, and you're sick of hearing by now, knowing the bones lets you know where the muscle's attached to. And just because I said facial muscles aren't super important structurally speaking, we are going to be learning about the temporal mandibular joint and all sorts of important stuff that is extremely important because you will have clients come to you all the time with TMJ syndrome. Okay, well, let me grab my skull that I don't have because somebody borrowed it. Okay, never mind. I think the estheticians took my skull. Some of the bones on the face will make sense to you guys because we've been talking about them, and some make sense just because where they're located. So your forehead that's in front of your head is called your frontal bone. This is your frontal bone. These two bones on the side are your parietal bones. Down here is your temporal bone. Yeah? We all know about the mandible. The mandible actually inserts into the temporal bone. Remember, we're going to talk about all the features of temporal bone. Remember, the temporal bone has a zygomatic arch coming out of it, and we see here in this picture that it actually meets up with the zygomatic bone. The zygomatic bone and the temporal zygomatic arch make up your cheekbones. And they all like to come together right here in the maxilla, like a mask, maxilla. We've also got some very teeny tiny bones called the lacrimals. They're literally back here in your eye. And ethmoid, which is even further behind that you will probably never touch as a massage therapist. And a bone that you've probably actually never seen on even if you've seen a dead skull or whatever, is the vomer. The vomer is this bone that's really tiny. It's deep back in your nose here, and the reason you've never seen it is once somebody dies, that little teeny bone just kind of falls out. And so you've probably never even seen one. The jaw is left behind, the teeth are left behind, the maxilla is left behind, all this other stuff's left behind, but that little sucker usually goes, so you've probably actually never seen one in real life. They just tend to not stay intact, and they get lost. And what we cannot see here, but it is actually in the back of your eyes and goes from one side of your head to the other, is the sphenoid bone that we're going to talk about that kind of locks every single bone together in your brain. By the way, if you guys notice these two little holes in the mandible, those are actually for nerves to come out so that you can have sensation here. They're nerve holes for nerves to go through. It's why people in karate and boxing try to punch somebody right here. Because hitting the jaw snaps your head a lot, but also hitting this nerve right here causes a lot of pain. So they shoot for these. They're called mental foramen, and they aim for these. But really what they are is holes through the bone for the nerve to get out there so that I can feel my chin. It's kind of helpful, you know, I think. Here's the back of your head. On the back of your head is the occiput. That's your occipital region. The occiput is your occipital region. And back here we see a bump that you should be familiar with, the external occipital protuberance. In fact, there is an extremely important ligament that attaches to the external occipital protuberance and goes all the way down to the spinous process of C7. Does anybody remember what that ligament is called? Yes, Mr. Placencia, please.
Ligamentum nuchae.
Yes! Thank you, Mr. Placencia. It is called the ligamentum nuchae, and it's a very strong ligament that sews your whole cervical vertebrae together. From the back of your external occipital protuberance, which you should all be able to feel on the back of your head, down to C7. Super duper important stuff. You can see the superior nuchal line coming off this thing. Can somebody tell me a muscle that attaches to the superior nuchal line? Or even close to there? I don't even care if it's exactly there. It could be superior, inferior, anything in that area. We've got some pretty important muscles that attach in that area.
The splenius capitis, one of them.
Splenius capitis is definitely one of them. And also your trapezius. Your traps basically go all the way up there too. Yeah. But splenius capitis was excellent. That was the harder answer, I thought. Traps was the easier answer. Cool. And if we look over and keep going lateral, you'll see the temporal bone and you'll see the mastoid process of it behind the ears, right? And so far we know 3 muscles that attach to the mastoid process. Can anybody name those 3 muscles that attach to the mastoid process? Somebody already said one, actually. Yes, Miss Johnner.
I know of 2 for sure. It's the sternum cladoid mastoid, and then
Sternocleidomastoid is definitely one in front here. Boom, nice.
and then the levator scapula, right?
No. By the way, it's funny. Everybody says that in here. Like, you're the fourth person to say it, but the levator scapula goes into these transverse processes of C1 through C4. It doesn't hook into your head. It does start with an L.
Is it the longissimus?
Yeah. Longissimus comes all the way up the back and inserts up here. We think it's a major fascial line, and inserts into this thing, and then you got the sternocleidomastoid. And then there was one other one that somebody else mentioned for a different question. Anybody?
Is it the here, I'll let
Miss?
Splenius capitis.
Oh, Miss Sarno, go ahead. What?
Splenius capitis.
It is splenius capitis, yeah. That comes out, it gets the superior nuchal line, but it goes so far over, it also gets the mastoid process, yes. Yeah. And we will learn about a suprahyoid later that also attaches there. That's 4 things that attach in there. Cool. All right. Good stuff. So, you will be using this for your homework tonight. But of course, everything on this skull has a name, and then there are the sutures of the skull, and the sutures are a certain type of joint. Remember, we talked about it. They're a fibrous joint. They basically don't move. They have a little bit of flex to them. And so you have sutures between your, frontal bone and your parietal bones and your temporal bones and all that stuff. And this is a great side picture, too, for you guys to get a picture of where the hyoid bone is. The hyoid bone is actually above the cartilage, the thyroid cartilage, which is what we think of as your Adam's apple. The hyoid bone is actually above that. When you see somebody's Adam's apple sticking out, it's actually cartilage below their hyoid bone. And by the way, we think this is not true of everybody at all. But if you looked at 100 men and 100 women, men tend to have more of an Adam's apple. And it's not that they have more cartilage, it's actually that the angle of their thyroid cartilage is sharper. So they're more at an angle like this, and women tend to be a little bit more like this, and it makes their Adam's apple stick out more. That's all. It's just an angle thing. Yeah. Don't really have a lot to say about this, except from this picture, we should be able to see all the features of the temporal bone. So the temporal bone, coming off of it, it's got a zygomatic arch. That's part of the temporal bone, but the zygomatic arch runs into the zygomatic bone, and that makes your cheekbone. We also see the temporal mandibular joint. The temporal bone matches up with your mandible, and that's what makes your temporal mandibular joint. We also see your external auditory meatus, your ear hole. That is how you hear, through your temporal bone. We also see the mastoid process back here, which is where those 3 muscles hook to that we just talked about in a high tension area. Yep. We also, I don't know if they have it on here, they should, they do, good. We also have the styloid process, which is a little tiny toothpick thing back there. That is coming off the temporal bone, and later we will find out one of the suprahyoid muscles that hook to your hyoid bone attached to the styloid there. So all that's to help you articulate speech and swallow and all that good stuff. So these will be on your test questions for tonight. This is a view underneath the skull. So if you were looking up through my spine, you couldn't see this. You literally have to take somebody's head off. But this is looking up through their skull, right? There is a really big hole there. What do we call the really big hole in your skull?
Is it a spinal canal or foramen?
Foramen, yeah, it is the spinal canal, by the way. You're right, the spine goes up through there, but it's a foramen. That's a hole, and this is your foramen magnum, which just means big hole. But that is where your brain stem comes down and goes down your back. Yep. Very cool. All right. Let's move right along. Oh, we don't have to go into trails. That's okay. All right, everybody. Except here is a picture of the sphenoid bone inside your brain. It looks like a bat. I show it to you because you can literally touch it from two sides of your head. It goes behind your eyeballs and touches a whole bunch of other bones. So we care about it because it shows how locked together your whole skull is and how small changes could cause headaches and things like that. And we really believe that when stuff pulls on your head, it kind of shifts these bones around and can cause discomfort. So that's why we show it to you. All right, that said, let's take a